I might stand up.
Okay.
After this one.
Okay. Thank you for your patience, Anna. All right, we good to go?
Mm-hmm.
Okay. All right, so the Himalayan salt stones are also lovely in the neck. I use one at a time, and I'm supporting her head and neck with my other hand, and then I have a stone just in one hand. And it can be nice to get into the traps and all the neck muscles, and all the way up to the occiput. You can get the fascia even right as it's on the mastoid process, kind of where the SCM is, and all this fascia, and kind of pull it off with the stone. And we can use our edges for that. But I'm going to start off kind of with the bigger muscles and then kind of work my way there. So I was trying to show you what I was going to do, because the neck is going to hide, right? The stone is going to be under, what I'm doing a lot. So I'm under the traps with the stone, and then I'm squeezing the muscle here with my thumb. And so I've got the two between each other. And really sinking in. There's a good muscle there. How's that pressure?
Mm-hmm.
Cool.
Are you also pulling up with the stone while you're pressing with your thumbs?
Yes. And so I have like a nice bunch of tissue there squeezed between the stone and my thumb. And I'm going to slow down. And again, a lot of times if you just hold still, prolonged ischemic compression, a lot of times that's when the clients actually have the most profound experiences and releases. So don't be afraid to just hang out. And I'm going to turn her head to the side just to try to show you a little better what I'm going to do here. So I'm supporting her head and neck with my other hand. And I'm not going to move her neck too far, but I'm going to take my fingers and go on one side of her muscles, and then get the other side of her muscles with the stone. And so I'll be squeezing the two together, but with her nose up. And could someone get me a fresh stone? I'd like to use a nice warm one for this.
You want a pointy one?
Sure. So I'm supporting her head and neck with my other hand. Oh, thank you so much. Oh, that's a nice warm one. That feel nice or too warm still?
A little too warm.
Okay, so I'm going to move it. Take some heat off. Warm up with the pecs. There's not a lot of room to move in the neck area. So you can do, if you need to move off a little heat, you can do that with the pecs or arms. That feels like it should be better for you. How's this? Okay, good. So I got my fingers on the medial side and the stone on the lateral side, and I'm gonna do kind of a wave-like motion between the two. And you can use the edge of the stone. I'm gonna use this edge of the stone to really kind of sink into those muscles. Now, if we're in the posterior aspect of the muscles, this feels great. What we don't want to do, we don't want to cross anterior, we don't to SCM. And then we can get into the, jugular vein. But when we're behind that, these are lovely muscles to sink into. So I'm doing that kind of pulling, squeezing motion. And how's that amount of pressure, Anna? Good. Cool.
Can you also do that with the regular hot stones?
Yes. Oh yeah, there's some good muscles there. Yeah. And I'm gonna slow down here a minute, just take some deep breaths. You can invite the client to take deep breaths too, or oftentimes just if you even slow down and take deep breaths, the clients will pick up on those cues. Some people like to give the cues verbally, and some people just give the cues somatically. So now I'm going to scoop from the suboccipital area inferiorly. I'm going to use my arm on the table as a lever. And I'm going to push her head in a comforting way into the stone a little bit. So I'm rotating her head to the right a little bit as I pull down from the occiput. And how's that pressure?
It's a 7.
Okay, good. And now I'm using the edge of the stone closest to my body to pull up into the occiput. Could you guys back away or be quiet? So I'm going to use this part of the stone now and pull up into the occiput. Been kind of working through the layers and warming things up, and now, you know, there's some specifically tight fascia at those attachments, which is super typical. And so now I'm taking this edge of the stone up into it. The edge of the stone I just pointed out, that's closer to the base of my hand. It's closer to her ear. And now I'm pulling up and away, like traction. And I only do this one side at a time. I like to focus my neck work mostly one side at a time. Now I'm pushing in more medially, but also at the suboccipital area there's some more tight muscles, and I'm going to lean into that. And I'm squeezing, so my fingers are squeezing into the stones. And how's the pressure out of 1 to 10?
7.
Great. I kind of create like a spacious, listening sort of attitude. So even if you're at a 7, you want to be really in a very patient, listening, calm space. You're not just like pushing into a 7, but you're really holding space for the client. And the subtle shifts are hard to see when you're watching a neck demo, you know, because a lot of my hand is underneath her, so I'm trying to explain what I'm doing. But as an area lets go, I shift with my fingers and where I'm pressing on the stone to really apply the pressure in a way that gets the tight areas. Anna, since they can't see it so well, would you describe anything about what it feels like?
I can just feel you squeezing and then pushing up into the opposite. I can't even talk. I'm so tired. It feels like it's releasing a little bit.
Cool. And now my stone is relaxing, and I'm using my fingertips up in the spines of the scapula. And I'm going to release and just kind of assess where things are at. So you can take that kind of work all the way into levator scapula and the top of the traps and, you know, where the SCM attaches. It would feel really good right here at the base.
Mm-hmm.
Yeah, could you get me 2 more, please? Here, I'll trade you. So many people hold a lot of tension right at the base of the spine, like at C7, T1, right where my fingertips are right now. And it can be a tricky area to release. So if I take some of the heat off, thank you so much. If I take some of the heat off of these stones, then I can use them right up in that area, kind of like this. So these okay on your pecs? So we're just going to take a little heat off by moving them. And we're going to warm up the traps a little bit. And in my 30 years of doing massage, this is my first year to have a giant TV screen of what I'm doing right in front of me. So it's a very interesting cue. Normally I just feel what I'm doing. It's a very interesting cue to also watch what I'm doing. So thank you for that. All right, so there's enough heat off of these now. What I want to do is, you know, offer enough support as I do this that I don't either pinch her or press her bony landmarks. So I'm using my left hand to lift and feel the spinous processes, so that when the stone goes in here, it's yummy and not feeling like it's on the spinous processes. So now I'm going to kind of switch roles, and my right hand is going to be the protective sensor, and my left hand is going to place the stone. And most people enjoy this kind of warm support in that area, yeah? So what I could do, oops, we lost our somehow. You want to, is that one still recording? Okay, cool. Should we just keep going on this one, or stop and start while we solve it?
Maybe.
Okay, we'll stop.